The following portion of Studio 512 is sponsored by Advanced Pain Care. Hey y'all, going through cancer, of course, can be really challenging, both emotionally and physically. Pain management specialist Dr. Marco Uribe is here to talk to us about how advanced pain care can address specific issues affecting cancer patients. So let's talk about the common types of pain experienced by cancer patients and maybe how that differs from typical pain that somebody else might experience.
Yeah, it's definitely different than your typical pain patient. Cancer pain, is very multifaceted. You have neuropathic pain, which is pain from the nerves when sometimes the tumor is growing or sometimes the cancer is advancing and it's impacting nerves, sending sporadic signals that we can intervene with. There's also nociceptive pain, which is just a fancy word for saying, damage to the tissues or damage to the body that can cause these sporadic pain signals to impact you and make you feel that type of pain.
Let's talk about what the different treatment options are that are available for managing cancer pain.
Definitely, there's a lot of different options. With cancer pain, it's the whole patient, like we've talked about. Oftentimes, one of the cornerstones of therapy is medications, but with cancer patients uniquely, they're oftentimes on a lot of medications that may be the cause of some of their pains.
Right.
So, yes, we use medications to the best extent that we can, and that's what they're for patients that are going through this battle. Part of my job and my training is to find other unique ways to try and intercept that pain. And some of those are nerve blocks, it's spine procedures or nerve ablations, epidural injections.
You guys have a host of ways to help people in all different types of pain.
Exactly, yeah. So using a whole team is very, very important. It's not just the body that's sick, it's the whole human being and their experience with their relationships and their mood and their sleep. And so we use an interdisciplinary team approach at Advanced Pain Care with psychology. We communicate with the oncologist. We communicate with the surgical oncologist, the radiation oncologist, all the different therapies that they may be getting from the oncology perspective. We just kind of add in, let's make it one big team. Let's all talk together about how we can best address you.
Absolutely, getting better outcomes for patients who are in pain. Dr. Uribe, we really appreciate your time. Thank you.
Thank you for having me.
To learn more about what you could do if pain wasn't holding you back, talk to the doctors at Advanced Pain Care. Go to austinpaindoctor.com to get help managing your pain today. The preceding portion of Studio 512 was sponsored by Advanced Pain Care.